My name is Scott Haller. I am one of the owners here at Shift and clinical osteopath. The osteopathic world is something that that I started back almost about 8 years ago, and it really came from working in a multidisciplinary setting and having chiropractors and physiotherapists and athletic therapists, and each had their own sort of thing that they did, and it was always that question of, why do we have so many independent, different areas? What about the body functioning all together and the use of each of these? And as that question was sort of coming up to me, the osteopathic training became available, in Ontario. And really, what grabbed me about it was, people ask all the time, what is osteopathy? What is it? What is it about? And to me, it was a philosophy, and the philosophy really was, that the body functions all together. We have muscles, we have joints, we have bones, we have nerves, but they all work interrelated to one another, and we can't so simply isolate one problem as that's the only thing. If we have a joint problem, the muscles and soft tissue are affected around that. So to have the ability to look at that was important. The second thing that really sort of came to me along the way was, we oftentimes in rehab, we have a patient who complains of a particular pain. They say, my elbow hurts. And we've all been taught, this is the elbow, this is how it functions, here are the muscles, here are the nerves. But the osteopathic world stood back and said, okay, we understand that the elbow is sore, but why? Why is it sore? What is creating that, that pain? And it's interesting because in medicine, we've well understood it. We know that if I have tightness in my left chest and numbness down my left arm, that we know that that's, most oftentimes a heart-based issue. So if the heart is the problem, why do I feel it in the arm? It's been well accepted that that be the case. So then to take other physical pains or problems in our body and say that it has to be where I say it hurts is the problem, just didn't make sense. And that was really the osteopathic world, was saying, not what is wrong, but rather why is it wrong? What is not what is the problem, but what is creating that problem, and that's what interested me about studying osteopathy, and certainly that's that is at the forefront of my practice. Most of the patients that I get to see are people that have probably gone through the traditional, chiropractic, physiotherapy, massage therapy, athletic therapy kind of world, because it's not all that well known. Osteopaths are certainly becoming more known, but I tend to see those patients that have been around and are unresolved, and they're landing in my office. And one of the things that is interesting is, a very common question is, what are you going to do that the rest of the people that I have seen didn't? And those people that they've been to see are excellent in their own professions. It really, again, is stepping back and looking at it very differently than most of our rehabilitation world, and that is not what is wrong, but why is it wrong? And I think that's just a different approach and a different thought process. And so for who should be coming to see an osteopath, really anybody. I mean, with any problems, I think we're starting to see now more of the osteopathic knowledge, and in amongst the public, they're certainly being more sought after. So I think that is somewhat starting to change. But really, there's a variety of different reasons why someone would be seeing an osteopath.